I'm Ritu Sharma from DRS Medical Associates. I'm a primary care physician who takes care of adults and kids right here in Jersey City. Over the last few months, there has been a lot of press about Zika infections, but the information is often incomplete and totally sensationalized. So today, I'll be addressing the most common questions I've received from you about Zika so that you can better understand it. So what is Zika? Believe it or not, it's a viral infection that's been around since the 1940s. It gets transmitted through mosquito bites, sexual contact, and unfortunately, pregnant women can give it to their unborn babies. So naturally, you want to avoid getting it. It's found in a lot of common places, such as South America, the Caribbean, and some of the Pacific Islands as well. More specifically, here's a list of all the countries that have been infected. Unfortunately, it is a very long list, and I'll discuss later what you should do if you absolutely must go to these countries. Scientists have found this virus over 50 years ago in Asia and Africa. But throughout these years, the symptoms were very mild and it wasn't considered to be a major problem. People in those areas often developed immunity to the disease. Around 2007, Zika actually started to spread west, and it was only in 2015 that doctors started to notice babies being born with microcephaly, which is an abnormal brain growth causing a very small head. So that's when doctors started to study Zika further. They are actually very mild symptoms, and most of the time people get them within 2 to 14 days of exposure. The most common things you want to look for are fever, rash, pain in your hands and feet, and redness in your eyes. I know, if you put those symptoms online and search for what you have, it'll probably say you have the plague. But please, talk to your doctor before you decide on your diagnosis. There are no reports of deaths or even hospitalizations from Zika in adults. The only deaths that we've heard about are babies that were exposed to Zika before they were born. If you have any concerns or are more worried about Zika than just having mild symptoms, please speak to your doctor. Or if you would like to look online, you can go to cdc.gov for a trusted website with information. So if you plan on conceiving a child or getting pregnant within the next 6 months, please cancel your trip. I know, that's not what you wanted to hear, but unfortunately, Zika is very deadly for babies, and that's why I suggest doing that. If you absolutely must go, there are some precautions that you can take. The very first thing is, don't have any unprotected sex. The other thing you can do is avoid mosquito bites. So try to stay indoors as much as possible, and when you're inside, make sure you're using air conditioning whenever it's available to you. When you are outside, make sure you're wearing long sleeves and long pants. So when applying mosquito repellent, make sure you spray it onto your clothes. And then when you need to put it on your face, you actually spray the repellent onto your hands and place it onto your face. Then spray any skin that's exposed. And you can use this for children over the age of 2 months. It's safe. But make sure you always read the labels before you put anything on children. You also want to make sure that the repellent has these following active ingredients so they truly work against repelling mosquitoes. Testing is actually done on your blood and your urine, but results are more accurate if you're tested within 2 weeks of any kind of symptoms. You may also need to be tested for dengue and chikungunya, which are other viral infections you can get from mosquito bites, based on what symptoms you have. If you feel like you have these symptoms, please don't wait. Schedule an appointment right away with your doctor because these test results often take several weeks to come back. Well, right now, all the testing has to be approved by your local health department. So you need to be seen by your primary care doctor and have a proper evaluation. If he feels that your symptoms are confirmed and that you are eligible for testing, you can have it done. Well, right now we don't have any medications that specifically treat Zika virus. The most important thing is to make sure you don't become dehydrated. Stay rested and make sure you drink lots of fluid. You can also use Tylenol for your pain and for your fevers. Try to avoid any kind of NSAIDs like aspirin or ibuprofen or Motrin, because in case you have dengue, we don't want you taking those medications. Now, most people feel better within a week. If you don't, make sure you see your doctor again. The biggest concern about Zika is when you get infected during pregnancy. So the big risk is something called microcephaly. That's actually abnormal brain growth causing a small head. The other problems that babies can have are eye defects and ear defects as well too, and possibly even death. Well, if a baby is exposed while he's still inside mom, then he will definitely need to be monitored for any kind of growth defects, eye abnormalities, and ear abnormalities. So lots of eye tests and hearing tests. But if a baby is exposed after being born, then the symptoms are mild, just like adults, and there's no concern for their growth or their development, and they don't need to be monitored as closely as the other babies do. We don't really know whether that affects future pregnancies, but we do know this. If you have been to a Zika endemic area or have symptoms of Zika, please wait at least 8 weeks before trying to get pregnant. And if you're a man and thinking about conceiving, we want you to wait at least 6 months before trying to conceive, because the virus lives longer in semen. Well, there are some things that we can do to just prevent mosquitoes in general. The number one thing, make sure there is no standing water around your house. So things like bird baths, flower pots often have areas that water collects. You want to make sure that there's no water around there at all. The other thing you can use are insecticides, and they often kill mosquito larvae and eggs as well too. The other thing we can do is just educate people that have been to Zika endemic areas and tell them to be safe. The easiest way they can be safe is make sure they don't have any unprotected sex at all, and to try to avoid getting mosquito bites for at least 3 weeks after they come back, even if they don't have any symptoms at all. So let's make sure we tell all our friends about this and educate everybody locally. Share this video and tell everybody about the risk of Zika, even here in our local area. I hope this clears up any questions you guys had about Zika. If you have any more concerns, please speak to your doctor. Thanks again for watching, and stay healthy.